Question 1. Which of the following is the best way to reduce patient exposure to radiation during a dental radiographic procedure? A. Using a longer cone, p-day. B. Increasing the milliamperage, mA. C. Using a rectangular collimator. D. Decreasing the source-to-film distance. Answer, C. Using a rectangular collimator. This question tests your knowledge of radiation protection, specifically focusing on methods to minimize patient exposure. The keyword best way highlights the most effective method among the choices. A rectangular collimator significantly reduces the exposed area of the patient's face by restricting the X-ray beam to the approximate size of the image receptor, unlike a round collimator which exposes a larger area. For instance, imagine a spotlight. A rectangular shape focuses the light more precisely than a wide circle. Always remember that minimizing the irradiated area is a crucial step in adhering to the ALARA principle. Question 2. The ALARA concept in dental radiography states that all radiation exposure should be kept. A. As low as reasonably achievable. B. At levels approved by regulatory agencies. C. As low as required by the administrator. D. Above low area radiation avoidance. Answer. A. As low as reasonably achievable. This question centers on the fundamental principle of radiation protection, ALARA. The question asks for the meaning of the acronym ALARA, which is a key concept for anyone working with radiation. It emphasizes that even if an exposure is below regulatory limits, efforts should always be made to reduce it further if possible, balancing the diagnostic benefit against the risk. For example, using a lead apron or faster film/digital sensors helps achieve this goal. Keeping the acronym and its meaning in mind will always guide your practice towards maximum safety. Question 3. Which type of radiation has a short wavelength and high frequency? A. Visible light. B. Infrared radiation. C. Ultraviolet radiation. D. X radiation. Answer, D. X radiation. This question assesses your understanding of basic radiation physics, specifically the characteristics of electromagnetic radiation. The keywords short wavelength and high frequency are definitive properties of X-rays, indicating their high energy and penetrating power, which is why they are used in dental imaging. Other forms of radiation listed have longer wavelengths and lower frequencies compared to X-rays. Think of X-rays as being at the very energetic end of the electromagnetic spectrum, allowing them to pass through tissues and create an image. Understanding these basic properties helps explain why X-rays behave the way they do when interacting with matter. Question 4. What is the primary purpose of the lead apron with a thyroid collar? A. To prevent motion during exposure. B. To protect reproductive and blood-forming tissues from scatter radiation. C. To hold the film in place during the procedure. D. To absorb primary X-ray photons. Answer, B. To protect reproductive and blood-forming tissues from scatter radiation. This question tests your knowledge of patient protection measures. The primary purpose of the lead apron and thyroid collar is a crucial safety concept. These protective devices are designed to shield radiosensitive organs like the thyroid gland and reproductive organs from harmful scatter radiation, which is secondary radiation that has been deflected from its path. It is important to remember that these aprons protect against scatter, not the direct primary beam, which is what is used for image formation. Always ensure your patient is wearing proper protective shielding for every exposure. Question 5. The paralleling technique is recommended because it produces an image with A. Minimal object distortion. B. Increased magnification. C. Shorter cone length. D. Overlapping contacts. Answer: A. Minimal object distortion. This question focuses on the advantages of a specific radiographic technique. The paralleling technique is preferred because it places the image receptor parallel to the long axis of the tooth and the central ray perpendicular to both, resulting in an image with the most accurate representation of tooth length and anatomy, thus minimizing distortion. While some magnification occurs due to increased object-to-receptor distance, the primary benefit is the reduction of shape distortion. For example, if you stand a pole straight up and shine a light directly at it, the shadow will be an accurate length, similar to how the paralleling technique works. Always aim for accurate images to ensure proper diagnosis. Question 6. A dental X-ray film that has not been exposed to radiation but appears completely black after processing indicates that the film was A. Overexposed to radiation. B. Exposed to white light before processing. C. Underexposed to radiation. D. Left in the developer solution for too short a time. Answer: B. Exposed to white light before processing. This question assesses your understanding of film processing errors. The key clue is completely black after processing without having been exposed to radiation. This outcome is characteristic of film that has been exposed to white light, causing all the silver halide crystals to be activated, which then turn black during development. If it were overexposed to X-rays, there would still be some differentiation, and underexposed films appear light. Always ensure your darkroom is light-tight and that film packets are only opened in safe light conditions. Question 7. What does the term radiopaque describe in a dental radiograph? A. Structures that appear dark or black. B. Structures that permit the passage of X-rays. C. Structures that appear white or light. D. Structures that are fluid-filled. Answer: C. Structures that appear white or light. This question tests your understanding of basic radiographic terminology. Radiopaque refers to structures that resist the passage of X-rays due to their density or atomic number, causing fewer X-rays to reach the image receptor. Consequently, these areas appear white or light on the radiograph, like bone or enamel. In contrast, radiolucent structures, such as soft tissues or air spaces, allow X-rays to pass through easily and appear dark. For instance, the enamel on a tooth will appear bright white because it's highly radiopaque. Remembering this fundamental concept helps you interpret radiographs correctly. Question 8. The amount of radiation absorbed by the body is measured in A. Röntgens, R. B. Sieverts, SV. C. Coulombs per kilogram, C/kg. D. Gray, GY. Answer: D. Gray, GY. This question is about the units of radiation measurement, specifically absorbed dose. The Gray, GY, is the unit used to measure the amount of energy absorbed by a tissue or object from any type of ionizing radiation. While Röntgens measure exposure in air and Sieverts measure dose equivalent, biological effect, the Gray directly quantifies the absorbed dose. For example, if a certain amount of radiation energy is deposited into a kilogram of tissue, that measurement is expressed in grays. Knowing these units is vital for understanding radiation protection and safety standards. Question 9. Which of the following conditions would result in a radiograph that is too dark? A. Insufficient exposure time. B. Excessive developing time. C. Weak developer solution. D. Cooler developer temperature. Answer B. Excessive developing time. This question focuses on common processing errors in film radiography. A film that is too dark indicates that too many silver halide crystals were converted to black metallic silver. This can happen if the film is left in the developer solution for too long, allowing excessive chemical reduction to occur. Conversely, insufficient exposure, weak developer, or cooler developer temperatures would result in a lighter film. Think of it like cooking. Too much time in the oven can burn your food, making it too dark. Proper adherence to manufacturers' recommended processing times is essential for optimal image quality. Question 10. To achieve a longer scale of contrast on a radiograph, you should use A. A higher kilovoltage, kVp, setting. B. A lower kilovoltage, kVp, setting. C. Increased milliamperage, mA. D. Decreased exposure time. Answer A. A higher kilovoltage, kVp, setting. This question tests your understanding of radiographic contrast and exposure factors. Longer scale of contrast refers to an image with many shades of gray, indicating subtle differences between tissues. This is achieved by using a higher kilovoltage, kVp, setting, which produces X-ray photons with greater penetrating power and a wider range of energies. A lower kVp results in a shorter scale of contrast, fewer shades of gray, more black and white. For example, a high kVp image is useful for detecting early signs of periodontal disease, where subtle density changes are crucial. Always remember that kVp directly influences the quality and scale of contrast. Question 11. What is the primary function of the anode in an X-ray tube? A. To produce electrons. B. To focus the electron beam. C. To convert electrons into X-ray photons. D. To heat the filament. Answer C. To convert electrons into X-ray photons. This question addresses the basic components and function of the X-ray tube. The anode is the positive electrode in the X-ray tube, and its primary role is to act as the target for the electrons accelerated from the cathode. When these high-speed electrons strike the anode, specifically the tungsten target, their kinetic energy is converted into X-ray photons and heat. The cathode, not the anode, produces electrons and heats the filament. Understanding these fundamental parts helps you grasp how X-rays are generated. Question 12. If a dental radiograph appears too light, but the exposure settings were correct, what could be a possible cause? A. Overdeveloped film. B. Developer solution too warm. C. Exhausted fixer solution. D. Insufficient exposure time. Answer C. Exhausted fixer solution. This question focuses on another common processing error in film radiography. If a radiograph appears too light despite correct exposure, it suggests an issue with the chemical processing. Exhausted, worn out, fixer solution cannot properly remove unexposed silver halide crystals from the emulsion, leaving residual silver that makes the image appear faded or light, sometimes with a brownish tint over time. Overdeveloping or warm developer would lead to a dark film, and insufficient exposure time would also result in a light film, but the question specifies correct exposure settings. Always ensure your processing solutions are fresh and maintained according to manufacturer guidelines. Question 13. Which technique is most likely to result in overlapping contacts on a bite wing radiograph? A. Incorrect horizontal angulation. B. Incorrect vertical angulation. C. Insufficient exposure time. D. Excessive exposure time. Answer A. Incorrect horizontal angulation. This question tests your knowledge of common errors in radiographic technique. Overlapping contacts refers to a distortion where the contact points between adjacent teeth appear superimposed, making it impossible to diagnose interproximal caries. This error is directly caused by incorrect horizontal angulation, meaning the central ray of the X-ray beam was not directed parallel through the interproximal spaces. Incorrect vertical angulation causes foreshortening or elongation, not overlapping. Always ensure the X-ray beam is angled correctly through the teeth contacts for clear diagnostic images. Question 14. What is the recommended minimum distance for the operator to stand from the X-ray tube head during an exposure? A. 3 feet, 9 meters. B. 6 feet, 8 meters. C. 9 feet, 7 meters. D. 12 feet, 6 meters. Answer B. 6 feet, 8 meters. This question addresses operator protection, a critical aspect of radiation safety. The recommended minimum distance is a crucial safety guideline to minimize occupational exposure. Standing at least 6 feet, 8 meters, from the tube head provides significant protection because the intensity of the X-ray beam decreases rapidly with distance following the inverse square law. If shielding is not available, maximizing distance is the best way to reduce your exposure to scatter radiation. Always remember the principle of distance, shielding, and time for radiation protection. Question 15. The purpose of the dot on intraoral film is to A. Indicate the film speed. B. Aid in film orientation. C. Absorb scattered radiation. D. Distinguish between primary and secondary radiation. Answer B. Aid in film orientation. This question tests your practical knowledge of intraoral film features. The raised dot on one corner of the film packet, once processed, helps you orient the radiograph correctly, indicating the mesial or distal side of the teeth and distinguishing between the patient's right and left sides. Without this dot, it would be difficult to consistently mount and interpret the images accurately. For example, when mounting a full mouth series, the dot helps you correctly place each film in the mount. Always use the dot as a reliable guide for proper film orientation. Question 16. What is the ideal temperature range for manual processing developer solution? A. 50 to 60 degrees Fahrenheit, 10-15 degrees C. B. 68 to 72 degrees Fahrenheit, 20-22 degrees C. C. 80 to 85 degrees Fahrenheit, 27-29 degrees C. D. 90 to 95 degrees Fahrenheit, 32-35 degrees C. Answer B. 68 to 72 degrees Fahrenheit, 20-22 degrees C. This question focuses on the optimal conditions for manual film processing. The ideal temperature range for developer solution is critical because temperature significantly affects chemical activity. If the developer is too cold, it will be underactive, resulting in a light film. If it's too warm, it will be overactive, resulting in a dark film. The range of 68 to 72 degrees Fahrenheit, 20-22 degrees C, ensures optimal and consistent chemical reactions for proper image development. Maintaining precise temperature control is key to producing diagnostic quality radiographs consistently. Question 17. Which of the following is an example of an extraoral radiograph? A. Periapical. B. Bite wing. C. Occlusal. D. Panoramic. Answer D. Panoramic. This question asks you to distinguish between intraoral and extraoral radiographs. The keyword extraoral indicates that the image receptor, film or sensor, is positioned outside the patient's mouth during the exposure. A panoramic radiograph captures a wide view of the maxilla, mandible, and surrounding structures on a single image, making it a classic example of an extraoral projection. Periapical, bite wing, and occlusal radiographs all involve placing the image receptor inside the patient's mouth. Knowing the common types of radiographs helps you understand their applications in diagnosis. Question 18. The cumulative effect of radiation exposure means that A. Radiation effects are immediately apparent after exposure. B. Each radiation exposure adds to previous exposures, causing potential long-term damage. C. Radiation exposure is only harmful if it occurs during childhood. D. The body can completely repair all radiation damage over time. Answer B. Each radiation exposure adds to previous exposures, causing potential long-term damage. This question tests your understanding of the biological effects of radiation. The cumulative effect is a fundamental concept, meaning that radiation damage, even from small doses, can accumulate in the body over a person's lifetime. This accumulation increases the risk of long-term health effects, such as cancer. It's not about immediate symptoms, nor is all damage fully repaired, nor is it only harmful at a specific age. This principle underscores the importance of the ALARA concept in minimizing all unnecessary radiation exposure. Question 19. What is the primary cause of foreshortened images in the bisecting angle technique? A. Insufficient vertical angulation. B. Excessive vertical angulation. C. Incorrect horizontal angulation. D. Inadequate exposure time. Answer B. Excessive vertical angulation. This question addresses a common error in the bisecting angle technique. Foreshortened images appear shorter than the actual tooth and are caused by aiming the X-ray beam too steeply, excessive vertical angulation, towards the tooth and film. Conversely, insufficient vertical angulation leads to elongated images. Incorrect horizontal angulation causes overlapping contacts. Imagine shining a flashlight directly down on an object from above. Its shadow will appear shorter than the actual object. Understanding the relationship between angulation and image distortion is key to producing accurate radiographs. Question 20. A dental X-ray machine operating at 70 kVp requires a minimum total filtration of A. 0.5 mm of aluminum. B. 1.5 mm of aluminum. C. 2.5 mm of aluminum. D. 3.5 mm of aluminum. Answer C. 2.5 mm of aluminum. This question is about radiation safety regulations concerning X-ray equipment. Minimum total filtration is a regulatory requirement to remove low-energy, soft X-rays from the primary beam, which would otherwise be absorbed by the patient without contributing to image formation. For X-ray machines operating above 70 kVp, the federal standard mandates a minimum of 2.5 mm of aluminum filtration. Machines operating at or below 70 kVp typically require 1.5 mm. Filtration helps ensure that only the diagnostically useful X-rays reach the patient. Question 21. Which of the following statements is true regarding digital radiography sensors compared to traditional film? A. Digital sensors are less sensitive to radiation. B. Digital sensors require chemical processing. C. Digital sensors offer immediate image viewing. D. Digital sensors are less expensive to purchase initially. Answer C. Digital sensors offer immediate image viewing. This question explores the advantages of digital radiography. The key benefit of digital sensors is the near-instantaneous display of the radiographic image on a computer monitor, eliminating the need for darkroom processing and chemicals. This immediacy is a significant advantage over traditional film. Digital sensors are generally more sensitive, allowing for reduced radiation exposure, and while they don't require chemicals, their initial purchase cost is typically higher. The quick feedback from digital imaging helps improve workflow and patient communication. Question 22. What term describes the dose of radiation that the body can endure with little or no chance of suffering harmful effects? A. Maximum permissible dose, MD. B. Cumulative dose. C. Lethal dose. D. Threshold dose. Answer A. Maximum permissible dose, MD. This question tests your knowledge of radiation safety limits for occupational exposure. The maximum permissible dose, MD, is the term historically used to define the greatest amount of radiation exposure that an occupationally exposed person can receive in a given period, e.g., annually, without incurring unacceptable risk of adverse biological effects. While current terminology often uses dose limit, MPD is still a concept tested. It helps guide safety practices to protect dental professionals. Question 23. A blurred image on a radiograph is most likely caused by A. Excessive vertical angulation. B. Patient or tube head movement during exposure. C. Overexposure to radiation. D. Incorrect horizontal angulation. Answer B. Patient or tube head movement during exposure. This question focuses on a common cause of image degradation. A blurred image, often described as motion unsharpness, occurs when either the patient moves or the X-ray tube head moves even slightly during the brief moment of X-ray exposure. This movement causes the image of the tooth or structure to be smeared across the film or sensor. Excessive angulation causes distortion, not blur, and overexposure affects density. Always instruct your patient to remain perfectly still and ensure the tube head is securely positioned before pressing the exposure button. Question 24. What is the primary purpose of fixer solution in manual film processing? A. To convert silver halide crystals into metallic silver. B. To remove unexposed silver halide crystals from the film emulsion. C. To harden the film emulsion. D. To rinse the film after developing. Answer B. To remove unexposed silver halide crystals from the film emulsion. This question assesses your understanding of the roles of processing chemicals. The fixer solution plays a critical role in making the radiograph a permanent image. Its primary purpose is to dissolve and remove the unexposed and undeveloped silver halide crystals from the film emulsion, preventing the film from turning dark over time and leaving behind only the exposed silver that forms the image. The developer solution converts the exposed crystals, and rinsing occurs after fixing. Without proper fixing, the image would eventually fade and become diagnostically useless. Question 25. Which type of intraoral radiograph is best for detecting interproximal caries and assessing alveolar bone levels? A. Periapical. B. Occlusal. C. Bite wing. D. Panoramic. Answer C. Bite wing. This question asks about the specific diagnostic uses of different intraoral radiographs. Interproximal caries, cavities between teeth, and alveolar bone levels are best visualized on a bite wing radiograph. This type of radiograph shows the crowns of both maxillary and mandibular teeth on one film, specifically designed to capture clear images of the contact points and the crestal bone. Periapicals show the entire tooth and surrounding bone, occlusals show large areas of the jaw, and panoramics offer a broad overview, but bite wings are specifically tailored for these critical diagnostic tasks. Always prioritize bite wings for detecting early signs of interproximal decay and monitoring bone health.